Listening into the interview with Michael Gove, responding to some of those claims in the Sunday Times this morning. Now, you, of course, have been quite reluctant to criticise the government's response so far. Has that changed?
Well, I have to say, I think Michael Gove's line that one or two aspects of this story are off-beam is possibly the weakest rebuttal of a detailed expose in British political history. I mean, look, none of us expect the impossible. We understand that mistakes will be made in a crisis of this nature, but there are serious questions as to why the Prime Minister skipped five COBRA meetings throughout February, when the whole world could see how serious this was becoming. And we know that serious mistakes have been made. We know that our frontline NHS staff don't have the PPE, that they've been told this weekend that they won't necessarily have the gowns, which are vital to keep them safe. We know that our testing capacity is not at the level that is needed. We know that the ventilators that many hospitals have received are the wrong types of ventilators. And there are big questions about as to whether we went into this lockdown too slowly. And now we hear the Prime Minister missed 5 meetings at the start of this outbreak. I mean, it suggests that early on he was missing in action. So we do need to understand what was going on. And it's not good enough for the Chancellor of the Duchy of Lancaster to say, oh, 1 or 2 points were off beam. People deserve an explanation. And it's disappointing, I'm afraid, that Michael Gove wasn't able to give a full explanation a few moments ago.
At the same time, though, the government has successfully and rapidly ramped up capacity in the National Health Service. There's questions about whether they acted too slowly, but we're still really tracking the rates of deaths, very sadly, that we've seen in other Western European countries too. I mean, that doesn't really chime with evidence that we've done much worse or acted more slowly than our neighbours.
Well, I've got nothing but praise for the National Health Service in the way in which they've opened up the Nightingale hospitals across the country, and it does look like there's some spare capacity in those hospitals at the moment, and now we need to think about how we use that spare capacity, whether we can use that to help with the crisis in our social care sector, for example. Now, you talk about the fact that we are doing sort of out of line with some of our European neighbours, but Germany are testing far more people a day than we are, and Germany has a much lower death rate, for example. So we need to understand why testing has not been ramped up to the levels which are sufficient, why contact tracing has not been ramped up yet. We're in a lockdown now. We supported a lockdown, we support its extension, but we should be using this time to prepare for the next phase fighting this virus. And that means investing in testing and contact tracing, but it also means being clear with the British public about what happens next. We've still not had that clarity and transparency from ministers.
Talk a bit more about the exit strategy, but just on testing, we could hear Michael Gove there saying that they're on course to meet that target of 100,000 daily tests by the end of the month. Do you think that they'll meet it?
Well, the problem is government ministers told us we'll be doing 25,000 tests a day by now, and we're not. So we need to understand why the government are failing on the promise that they made for mid-April. Of course, if they meet their target of 100,000 tests a day, their promise of 100,000 tests a day, that would be welcome, but we've got to go further, because a lockdown is a blunt tool in and of itself. We need a testing and tracing strategy alongside it to help us manage and cope with this virus for the coming months. So let's see where we get to, but so far the government hasn't met the promises it's made before on testing.
Now, let's talk about the exit strategy, if you like, from the lockdown, shall we? Michael Gove very keen to not be drawn into specifics, saying that the government will be guided by the evidence. But Labour, of course, has called on the government to lay out its exit strategy. What does Labour think that should be?
Well, we want to see what the government plans are. I mean, I think as was suggested in Scotland, we shouldn't be treating people like children. People are grown-ups, and people need to understand what happens next, because the lockdown in itself is not a strategy. It is a tool as part of a strategy. But given that we know a vaccine might not be available for 18 months, we need to understand what is the government's plan between now and when a vaccine is available. We need to know whether the government have a serious plan to extend testing in the community and contact tracing. Look, we've got, for example, 750,000 volunteers have signed up to help in this outbreak. Could some of those people be helping with the contact tracing? Where are we on the apps that are being talked about? There's an NHS England app being developed. There's another app being developed by Google and Google. So, and we're hearing that the two apps might not be able to interact with each other. I mean, what's the government's response on that front? And also, as we go through this process of coming out of lockdown or relaxing some of the lockdown measures, we still need reassurances that our National Health Services will be able to cope. And yet we've still not got the PPE in our NHS. We've heard today how the British Healthcare Trading Association offered to help the government back in February, and now those offers fell on deaf ears. And every MP's inbox, or certainly my inbox, is awash with small firms across the country saying they've tried to help the government with PPE. They've tried to tell the government they can manufacture PPE, and they hit a brick wall. They don't get anything back from the government whatsoever. Well, there's a lot of wartime analogies used throughout in this process. Why aren't we using all our small firms like we did with the small boats in Dunkirk? Why are we not supporting British manufacturing, getting our firms manufacturing the PPE to keep our NHS staff safe? These are the things that the government need to tell us about, which is why we're calling for more clarity about the next stage of the outbreak.
It's one thing calling for more clarity on the next stage of the outbreak, for like a roadmap, if you like, out of the lockdown. But at the same time, we're not sure that we've passed the peak yet. The death numbers are still heartbreakingly high. Is there not a risk that by talking so much about the lockdown and the exit strategy, that you're confusing the message that people need to stay at home?
No, I think people understand they need to stay at home, and the British public have been tremendous in showing great resolve at staying home, and I think they should be hugely congratulated for that. But also, don't forget, a lockdown has other far-reaching health consequences as well. It means operations cancelled. It means people with cancer having their treatment delayed. It's leading to an increase in mental health problems. And of course, a lockdown impacts on the economy. And this is significant because if as a result of this lockdown, we see unemployment rising, poverty rising, that will have an impact on health outcomes as well. In fact, the Lancet suggests that a 1% increase in unemployment leads to a 2% increase in chronic health conditions. So all these things need to be taken into account when looking at the next stage of how we fight this virus, because our guiding principle should always be to save lives. But we're just asking for the government to give us some clarity, just asking for the government to tell us what is going on. I mean, the government are not even publishing the minutes from the Sage Committee. They've said they're going to publish the Sage Committee minutes after the pandemic has ended. That was in New Scientist just in the last 24 hours. I mean, that's not clarity, that's not transparency. We just want the government to level with us so we can understand what their plans are.